Thank you for joining us for VaxTalks. I'm Brad Satin, and we're joined today by Dr. Michael Miller. He is an independent healthcare life sciences consultant with Health Polcom and a board member with We Vax. Thanks for joining us, Dr. Miller.
Thank you, Brad. It's great to be here.
Today we're talking about something called LongCOVID, and I guess we start with the obvious question, Dr. Miller. What is LongCOVID?
Well, Brad, long COVID is a situation where somebody has the acute COVID or the infection with the virus, and then afterwards they continue to have symptoms like shortness of breath, fatigue, muscle ache, sometimes GI symptoms. And most concerningly for a lot of people is like brain fog, just an inability to concentrate. It doesn't happen all the time, but it happens a significant amount of the time. And it seems that there's really two types of long COVID. One is with ongoing symptoms related to the organ damage from the acute COVID, like they have pneumonia and they have continued problems breathing and shortness of breath. Another type that I believe is related to an ongoing inflammation or an autoimmune kind of situation that we see, and that can involve that continues after the acute COVID for months on end. And of course, there can be a mixture of the two, and research is going on to try to determine what's the cause of these symptoms, distinguish between the types, and a variety of ways to diagnose and test and treat.
Do we know how common it is right now?
That's still being researched. The director of the NIH said about a week ago at a hearing that he thinks up to 30% of people who've been infected with the virus or had COVID may have ongoing symptoms.
And I guess we don't know how long the symptoms could last, just how long COVID could hang on.
That's correct. I was talking to a graduate student last week who a year earlier in March of 2020 had COVID, and now a year later, when he tries to exercise, biking, running, things he used to do without problems before, sporadically he has shortness of breath. And the belief is that many people have symptoms that will slowly get better, but the research is just ongoing now.
So do you have a sense of how long before we might have a better understanding? Might it be months? Are we possibly years away?
Well, we already have a better understanding because people are out there, the clinicians, the researchers, the government, and the patients themselves are collecting information and creating a knowledge base. So that's the first step. The second step is how best to test and diagnose and to monitor somebody's symptoms, and then what's the best way to treat. That's the ultimate goal, is to get resolution. And I think that'll be coming in stages over the next, months, I would say, not years, certainly.
Well, great information, Dr. Miller. Thanks so much for joining us.
Thank you, Brad. It's been a pleasure.
And thank you for joining us for this edition of VaxTalks. And for more information, go to whywevax.org.